Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner Davis.
All right, here we go live. Good evening, everybody. I'm your host, Ed McQueen, of course, none other than Ms. April Garner Davis. It's our co-host, and we're glad to be here today. I think I can speak for April on that. We're always glad to see what our audience is going to give, what kind of feedback our audience is going to give us. And today, as you all saw in the promo, I'm going to talk about the future of pharmacology. Hey, I think it's courtesy that I should start off with a definition of pharmacology. Okay, I don't know if that's a word that's being used all the time or not. So it would be a good idea, I believe. But it's the definition of pharmacology. Pharmacology is a biomedical science that deals with the research, discovery, and characterization of chemicals, which show biological effects and education of the cellular cells. It could go on and say the impact that it has on addressing medical needs of human beings. We're talking about pills or whatever, or liquid form of medication. But you all are certainly welcome to join in and give us any more thoughts on that, what you believe that pharmacology is. And so, having said that, I think April, what do you have to say about that? I'm just going to defer to you right now, and then we'll get to our guests. But I don't want.
Well, yeah. First of all, I would like to welcome our studio audience. We thank you for tuning in tonight. And if you hear a bit of feedback, we try to fix that. I'm still hearing it, and it sounds a little weird, so please bear with us. But thank you for joining in, and please post your questions and comments for our special guest, who's going to be able to tell us more. It might be coming from that piece, Brother Edward, because when you were playing around with that, is there any way to just do away with that piece altogether and unplug it? Let's see if that helps.
Now, is it any different?
Testing. Nope, still feedback.
What about
no, there's still feedback. I can hear myself. I'm listening to myself. I can hear
Yeah, there's a button on here that maybe I should discard that completely.
Okay. All right, while you're working on that, I'm going to go ahead and maybe mute yourself. See if that helps for a second. Yes, that helps a lot. I'm going to introduce tonight's guest, Christian Newman. He is the person who can tell us more about what pharmacology is, and the article that is going to be published or is already published in the, I think it's the July issue of World Community Magazine, From Prescription to Precision, the Future of Pharmacology. So we're going to learn more from Christian tonight. Let's go ahead and bring him on. And hey, Christian, how are you doing?
Good, I'm doing well. How about yourself?
All right. I'm not even going to attempt to act like I know what pharmacology is all about. I'm looking at your article, and it says it's the study of how drugs interact within our bodies. Now, that part is intriguing to me because if our viewers are like me, we're probably taking more than one kind of medication, and we're wondering, how does it even all work together? How does it know what to do when it gets into your body, right? So I'm sure that's a part of what you're going to talk about tonight. So for those viewers who do not know who you are, do you want to introduce yourself a little and tell us a little bit about yourself?
Yes, so my name is Christian Newman. I'm currently in the Master of Science in Community Engaged Medicine at Furman University. I was born and raised in Myrtle Beach, South Carolina, with two amazing parents. And I'm just super excited to aspire and mentor future healthcare professionals and continue my future physician lifestyle. So I'm super excited.
We're excited to have you. And this is your second appearance on the show. And of course, you are our health editor in the magazine. So let's get into the topic for the night, the future of pharmacology. And what was shown on the promo was the question, why take medicine, basically. So you kick it off any way you want and teach us a little something tonight.
100%. So from personal experience, I take losartan.
We can't hear you, Brother Edward. We cannot hear you. Go ahead, Christian.
Yes. So just from personal experience, I take 2 different medications. So I take losartan 50 milligrams, and I also take omeprazole 20 milligrams. So I have clinical experiences in emergency medicine and family medicine, and both are pertinent avenues of taking medication. And it's just super important. And it's super cool because there's advancements in technology. That's where the future of pharmacology theme kind of comes from. So there's it helps us understand more precise diagnoses, precise doses, helps us with getting potential side effects. And then it also shows us how medications can be used to treat various diseases. So I'm super excited to talk about a couple of diseases and just chronic disorders that can help with medications along those lines. So.
We can begin anywhere you want to begin. That was a great lead in. And so, just however you want to break it down for us, we're here, we're listening.
Yes. So the first disorders I want to talk about hypertension. So that's definitely a chronic condition that I have. I have a family history of hypertension, and it's super important to know about hypertension because for Black individuals, I don't know if you heard this before, but physicians normally, as Black individuals, or don't prescribe Black individuals lisinopril, which is an ACE inhibitor. So they'll either prescribe Black individuals or any individual with HCTZ, which essentially helps the kidneys remove extra salt within the body, or angiotensin 2 receptor blockers, such as like losartan, which is what I take, that essentially just relaxes the blood vessels by blocking that hormone. Or they'll prescribe like calcium channel blockers, such as amlodipine. So there's various different medications for hypertension, even beta blockers such as metoprolol, which is important because if you have hypertension, if you don't know what hypertension is, high blood pressure. So it's essentially where the force of the blood against the artery walls is consistently high and makes the heart work harder than it needs to. So it's known as a silent killer. Symptoms, like I didn't have any symptoms, but when I went to Dr. McIver's office, he's my family physician, my blood pressure was around 160 over 110. And I do have white coat syndrome as well. So it's normally elevated when you're in clinic. But still I had to get prescribed medication. So I had to get prescribed 50 milligrams, which is definitely at a young age to get. My dad has high blood pressure. My mom had high blood pressure. So it's definitely at a young age. And when I was growing up, I've definitely been a stressful person. So that could be attributing to it as well. But yes, so untreated hypertension can certainly lead to heart attack, stroke, CKD. So it's definitely important that you get medical treatment intervention within you because an elevated blood pressure for a prolonged period of time can certainly it can be really bad. So
right. So I want to go back to something you said a little earlier, or towards the beginning. You mentioned lisinopril and amlodipine, and that typically lisinopril is not prescribed for members of the Black community. Is that correct?
Yes, ma'am.
So that is kind of like startling to me because I too have that as high blood pressure runs rampant in my family.
Yes, ma'am.
And the 2 drugs you mentioned are the 2 drugs that I am actually on.
Really? Wow.
Yeah, but I've always wondered, like, are they the best drugs for me? Yes. I can't really say that I've had any outward side effects. Like I think it was lisinopril, where there was claims that it would make your lips swell, or if you were having an allergic reaction to it, or but I can't really say I've had those symptoms. However, it might be nice, or it might be a good idea for me to ask my physician the next time I'm talking to them if I'm on the 2 drugs that are best for me as an African American female. Right. Yeah, what do you think about that?
It's very important to know that, and that's why we need more Black physicians as well, because it's different, because you just know based on your race, and you know based on your culture. So essentially lisinopril, it just puts you at a higher risk. Obviously it's genetically dispositioned. So lisinopril just puts you at a higher risk for, like what you said, like angioedema, because it's an ACE inhibitor. So like my physician, Dr. McIver, he prescribed me with losartan. So it just depends from person to person. There's obviously different gene effects and and genetic factors that goes into it as well. But lisinopril does put you at a higher risk of like angioedema, but certainly it depends based on the person.
What is angioedema?
So basically angioedema is like what you were saying with like lip swelling. Basically what you were saying, like the risk of it. It's basically just like where it can affect the tongue, it can affect the face. So like you said, it can basically just like the face, the swelling.
Okay.
You normally see it in the face swelling. Yes, ma'am. But if how long have you been taking your lisinopril?
I can't even, you know, it's been a minute. It has been a minute. And, you know, what if you haven't had any effects since then you know, you're maybe okay to be taking it. But like I said, it just, there's been research and there's been along those lines that lisinopril could cause angioedema because within Black individuals. So that's what I've learned with my clinical experiences as well. But it just varies depending on Well, and that's a good point to make, that, you know, certainly every drug is not for everybody. And, you know, I know other people who are dealing with hypertension and they're on a totally different drug than I'm on, or whatever the case is. And so, and they, you know, did have some side effects that I have never had before. Look, knock on wood and hope it doesn't happen tomorrow. But
yes, ma'am.
But anyway, so but that's good information to have, and definitely noted that I will talk to my physician in greater detail about it, and, you know, see if there are some like current research that maybe I just need to make them aware that I'm aware, right? Because we have to be our own advocates in the doctor's offices as well, not to try to you know, outdo the doctor, but you do have to speak up for yourself, right? To at least say, I know, I've heard this, someone said it, and I just want to know. Okay. So you were talking about that. You're getting into the beta blockers, and I don't know if there was anything else you wanted to add as far as hypertension is concerned.
No, not really for hypertension. Like I said, just please, like, with hypertension, you need to be checking your blood. If you have hypertension, you need to be checking your blood pressure continuously. It needs to be a daily log. I can definitely provide that. Dr. McIver provided me with a daily log. You need to be logging your blood pressure. So pre-hypertension is around 130 to 90. What you want is a 120 over 80 blood pressure. The systolic of 120 and a diastolic of 80. That is the textbook blood pressure that you want. If it's rising around 130s, 140s, 150s, medical intervention is definitely needed. So it just needs to happen for sure.
Okay, all right. So I'm looking at your article, trying to follow the flow. You following the flow of your article?
Yes,
and
ma'am.
make sure. Okay, all right. So and this is in the July issue of World Community Magazine,
ma'am.
correct?
Yes,
so
ma'am.
If you don't have your copy, and Brother Edward, are the copies available? I think they're already available. But if you don't have your copy, July 1 is like now. Oh my gosh.
Yes.
Woo, time is going by so fast. So whenever it comes out, I don't even know if it's out yet. Make sure you read Christian's article. But the next thing that he mentions in the article is diabetes. Let's talk about that.
Yes. So diabetes is another genetic disposition within my family. My grandma actually has diabetes. Diabetes is definitely it's an epidemic going on right now. So there's type 1 and type 2 diabetes. So type 1 diabetes is an autoimmune disorder. It's normally found when you're first born. Type 2 diabetes is normally like we talked about in my first broadcast about lifestyle medicine. It's about your daily lifestyle and how that happens. So with diabetes, it's really also important to have medical intervention, because I saw in the ED, like, you can have diabetic ketoacidosis, which is essentially like when your diabetes levels rises over like 300, 400. And it was crazy to see, because those patients had to go to the ICU because they had DKA. So it's important to have diabetes. And essentially diabetes, I didn't say the definition, but it's when your body doesn't make enough insulin. And insulin is produced by the pancreas. So it's when it can't produce enough insulin and when the body can't use this insulin effectively. So that's where the type 1 and type 2 diabetes certainly comes in. It's type 2 is more common. You'll see more patients come in with type 2 diabetes, and symptoms may even include urinary frequency. You'll have fatigue, and it could be kids or adults with type 2 diabetes. So you normally have diaphoresis. You normally have, which is sweating. You'll normally have a lot of dehydration as well, with dry mucus tongues and everything like that. And untreated diabetes, like I said, can lead to gangrene as well, where you can get your foot amputated. So it can get crazy. Diabetes can certainly get crazy. Like I said, DKA, gangrene, which can lead to foot amputation, and it can just certainly lead to a hyperglycemic state.
Mm-hmm. That diabetes is definitely something that's rampant in the Black community. I have it on both sides and have seen the the drastic effects of diabetes. I remember my grandmother on my father's side was actually an amputee because of diabetes, and it's the kind of thing that is I'm seeing it more and more, or hearing about it more and more in our community. And so, what do you think is like the main cause of it, or what attributes to cases of diabetes, and why is it happening so much in our community?
Yeah, definitely. I think one of the biggest things is obviously genetically. So type 1 diabetes, so it's going to happen genetically. And then the second big thing is the social determinants of health. I think that's a big part. So when it comes to poverty, when it comes to limited access to healthcare, when it comes to food deserts, when it comes to inadequate spaces for physical activity, those are big pertinent places where Black communities are experiencing, because you will also have social inequities, a limited education about what types of medications to use, which is why I feel like it's so important to know about pharmacology, because there's so much misinformation when it comes to, and not enough information to get educated on diabetic medications. So it's very important.
You're right about the social determinants of health, and it's amazing because those things are definitely root causes, miseducation, or just lack of education altogether.
Yes.
But also, as a part of that lack of education, the fact that we don't always know what the symptoms are.
Exactly.
So if you are having a diabetic episode, or if someone you're with is having a diabetic episode, sweating, feeling faint, or whatever it could be, we just don't know what that is. And so it is important for communities to make sure that there's some kind of diabetes education that's going on, and especially if they have a family history, I imagine, so that when it's happening, because diabetes is a life or death situation.
It is big.
Can be.
Yes,
Can be.
Yes, ma'am. But like I said, it can lead to those life-threatening diseases that can put you in the ICU. I saw so many patients with high hyperglycemia levels, which means high glucose levels. And with those high glucose levels, they got admitted into the ICU because they had to get treated. I'm pretty sure you get put on a saline bolus or some type of drip that helps out with diabetes there. So I feel like it's so important. Hypertension and diabetes, you gotta have medical intervention. It's very, very important, or else that certainly becomes life-threatening.
Let's talk about a medicine that I'm sure every diabetic has heard of, and that's metformin.
Yes. Yes. So metformin is the first line of treatment when it comes to lowering blood, or when it comes to lowering glucose production in the liver. And it also improves insulin sensitivity. And then you also have glipizide, you also have Januvia, you have Farxiga, you have Jardiance, and you have Humalog, which also is a fast-acting insulin. So each of those medications are very pertinent to treating diabetes, whether it's type 1 or type 2 diabetes. But yes, metformin is the first line of treatment that's more common to be treated for diabetes.
What do you think about the, there's been the introduction of your Ozempics and those types of medications? Yeah. What are your thoughts on that? Have you had any clinical experience on that?
Yeah. So I actually, in the ED, we actually had a patient come in that's been taking Ozempic that had an anaphylaxis episode, which is kind of like an allergic reaction. I've kind of heard mixed feelings when it comes to Ozempic, because it's for diabetes, but it's also for weight loss as well. So Ozempic is a new medication, but I've kind of heard mixed feelings from physicians, whether they like it or whether they don't like it. But yes, Ozempic is a new medication that's been introduced to treat diabetes as well. So like I said, I've heard mixed feelings with it.
Mixed feelings, yeah.
Experience. Yes, ma'am.
Yeah, and that probably comes from the fact that there seems to be like a mixed crowd that's actually using it. The people who are actually prescribed something like an Ozempic because it is to battle the diabetes, and those who are taking it for vanity reasons don't have an ailment, no diabetes, but they want the shot because they want to lose weight quickly. So I get that. You know, there's definitely some challenges with that. Brother Edward, do you want to try to chime in to see if we can hear you?
Yeah, can you hear me now?
Oh, yes, sir.
We can hear you.
Yeah.
And no echo. So whatever you did, hold it there. Don't touch it.
All right.
That worked.
Yeah, okay, that worked. That's good.
Yeah.
So April, the reason why this guy impresses us so much, in that he knows so much, apparently, because he studied a couple of summers, maybe one summer under Dr. McIver.
Yes.
And if you can't get the knowledge there, you can't get it in place. So,
Exactly.
he's going to throw some knowledge at him. So so that's why he sounded so knowledgeable about high blood pressure and stuff like that.
Yes.
And I think it's quite impressive. I mean, to me, some of the stuff those names that those medical terms that you're throwing out, I think it's good for people to grasp onto and hold on to, because you never know when you're going to need them again.
Yes.
And so when doctor starts talking to you and uses those kind of words, then you know what he or she is talking about. Yeah. So I'm thankful for that. I'm glad also thankful that you are the World Community Magazine's health editor.
Yes, sir.
That helps.
Yes, sir.
And your articles have been quite impressive. Good research that you've been doing.
Yes, sir.
And I don't have to converse to our audience that you are not a doctor, but that's. They can grasp. I don't. Sometimes just hearing you speak, I guess they say that they can't grasp that, and they didn't know that you were not a doctor. I'll give them that much credit. But anyway,
He's getting there.
Yeah. He's getting there. He's
getting close. Getting close. Yes, sir. Yes, ma'am.
Getting close. That's good, man. All these comments we got coming in, April.
Yeah, great comments. And there's a question that want to go back to real quick concerning hypertension. Priscilla Fuller, thank you for joining us tonight. Is age a factor regarding hypertension? And Miss Priscilla, probably still celebrating her birthday. She kind of slid into the room a little a few minutes after we started. But Christian gave us his story of how he's battling hypertension, and obviously a youthful young man, And so, is age a factor? Seems like no. Anybody can have hypertension, or what do you think it is like a main factor?
So I believe age. So it kind of varies based on genetic dispositions, first of all, but in general, age is definitely a significant factor when it comes to hypertension, because as we age, our organs start to shut down. Our organs, there's different changes within the arteries as they become stiffer, and definitely they become less compliant as well. So I think age once again, it depends based on your genetic disposition. It also depends on your lifestyle choices. So as we grow up, whether, we could be, whether you smoke, whether you drink, what your lifestyle choices is a big component whether you get hypertension or not. So when it comes to your question, age is definitely a factor when it comes to hypertension, just because as we grow, our organs start to eventually start shutting down. So, so it's definitely a factor for sure.
So since you brought up age, so what about when you reach the age like 96, which is the gentleman I'm about to tell everybody that just had a birthday of 96.
Oh, wow.
Yeah, so he must have been doing something, and none other than Reverend Lonnie Chestnut.
Yes.
So he just celebrated his 96.
Wow.
Well, so I'm telling you, I don't know about diabetes. I don't know about high blood pressure. He may not have had any of that stuff.
Well, his daughter Cassandra Campbell is watching, and of course he's my uncle. But I remember stories from Uncle Lonnie. He told us once upon a time, sitting around just talking and asking him, how do you do it? And this is when he was a young man, like in his 80s, I would say. But he said that they used to eat a lot of raw fruits and vegetables, literally walking through the garden or the field, plucking something and eating it, collards, whatever. And I know that a lot of people have gotten back to the idea of gardening and, doing their own harvesting of foods, and especially not only because the food prices are high in the grocery stores, but it's just healthier to do. If you're doing your own home gardening, you're probably not using all the pesticides and herbicides and things of that nature. If you're preparing it yourself, you know what you're putting into it. So how does diet play a role in it? Since that was one of the things that Uncle Lonnie mentioned to us as we were like kind of sitting around talking to him one day, that, he used to eat raw fruits and vegetables. Probably still does.
Well, he's doing something.
That's awesome. I hope I can certainly live that long, and that's awesome. I'm curious to see what types of if he's taking any medications, or if he's had those remedies like you were saying, whether he's eating amazingly, whether he's just has a great genetic lifestyle as well. It's just, there's so many different factors that comes into it as we age, and that's just 96. He's just, wow, that's an amazing age. I see Miss McIver Gma said he was riding a motorcycle on his recent birthday. That is wow.
Yeah, Drew Drayton gave him a ride, and he, yeah, that's awesome. That was really awesome. But yeah, so I'm sure that there, when it comes down to health factors, I know that one of the main question that we had for the topic tonight is not only about the future of pharmacology, but it's, why take medicine? And we're going to get back to that in a moment. But as people are trying to figure out what alternatives could exist, I'm sure that, adjusting the diet does have some role in that. Like I said earlier, maybe having conversations about or with your physicians about certain medications you're taking, paying close attention to how they make you feel. And also, the numbers don't lie. I mean, if you're taking medications and you go to the doctor, nothing is moving up or down or whatever, then, obviously the medicine is doing whatever, whether it's a good thing or a bad thing. Right, Christian?
Right.
Yes, ma'am. That's certainly important. What they have is they'll have those vital signs like you're talking. So they'll take your blood pressure, they'll get your pulse. They'll also get your respiration rate. They'll get your oxygenation status. They'll get your temperature. And then what they'll also do is they'll have labs. So they'll have a CBC, CMP. They'll have different types of labs along those lines that checks your glucose, that checks your sodium, that checks your cholesterol, which we'll talk about eventually with hyperlipidemia. So they'll check all those values, and then they'll try to have those interventions when it comes to treatment and medications.
Mm-hmm. So you just used another big word, Brother Edward, hyperlipidemia. We know it as high cholesterol. Let's talk about that.
Absolutely.
Yes.
That's a demon.
Yes. So hyperlipidemia is definitely a big, like Cousin Edward said, definitely a big old demon there. So it's essentially when excess of lipids gets in the blood. So fats can certainly clog our vessels, which can certainly cause cardiovascular issues. So what they'll have is they'll have your bad cholesterol on your labs, called the LDLs, and then they'll have your good cholesterol, which is your HDLs. So the point for medications is to remove that bad cholesterol that's forming all that plaque. So hyperlipidemia is diagnosed with the lipid panel. Like I said, those physicians are going to take labs. So they will test for your cholesterol within those lipid panels. And your cholesterol level should be below 200. That's where we want you, a healthy cholesterol level.
Is that a total number or?
Yes. So your total cholesterol level needs to be below 200. That's kind of the healthier level. If it's starting to go up, they'll start prescribing those medications, which I'll get into. But yes, like I said, it's going to cause atherosclerosis. It'll cause PAD, which is peripheral artery disease. It'll cause CAD, which is coronary artery disease, and can even cause stroke. So hyperlipidemia is definitely a demon for sure.
Yeah.
Yes.
It's a little more in depth, Christian, which was explained to me by Dr. McIver.
Yeah.
And you probably had touched on this. And that was that even though it's that total number should be under 200, but you could have a case in there if it is over 200 where your good cholesterol could overwhelm, and then it would compensate for the having a higher total, right?
Yes, sir. That is correct.
Kind of that balances things out. I brought that up because I think people need to know that. Yes, and don't get scared when they tell you when you see something that says under 200. read into it and see how much was the good cholesterol.
Right.
Yeah. If that's
Yes,
if that's overwhelmingly higher, then it's kind of eases your pain. Your worry a lot. So.
Yes, that's certainly important to note as well. Yes, sir. That's if that good cholesterol is higher. Yes, it certainly compensates for it.
Yeah. Just want to bring it up.
Yes, sir.
Mm-hmm. Well, tell us about statins.
Yeah, so statins are certainly important. So what you're going to have is those medications such as atorvastatin. You can also have simvastatin, which lowers those LDL levels. You can also have different types of inhibitors and fibrates and omega-3s that lower your triglycerides. So I hear that all the time. Your sodium, potassium, calcium, that's what you'll say, Dr. McIver, your triglycerides. So those are definitely important to note when it comes to hyperlipidemia. And insurance is also a big factor when it comes to all these type of medications. Because it's not cheap to get these types of medications. Like when I have 3 months supply for Milosartan, I believe my dad has Blue Cross Blue Shield, so I believe it's around $30 or something like that. But just I see the amount that's not with insurance. It's like $400, $500. I'm like, how can that be? Because I get a 90-day supply. So how can that be that much without insurance? Like, so different types of medications, especially the anticoagulants as well, such as like Eliquis or Xarelto or warfarin. Those medications are very expensive as well. So insurance definitely plays a role when it comes to getting medications.
Mm-hmm. And it's, I hate to say it, but sometimes insurance can be a bit of a game because it doesn't always cover the medications that you are prescribed. And so when I say it becomes a bit of a game, physicians have to figure out, okay, so if it's not going to cover this, what is the next thing that I can prescribe for you? And, unfortunately, there are some instances where insurance may not cover anything that you are prescribed, and then you'll have to come up with some kind of alternative that might not, handle the problem or deal with the problem as quickly as the prescribed medication. So it's, and that is something that is, I think, causing a little anxiety because it is so tricky. And now with everything that's kind of going on with what is going to happen with like Medicare, Medicaid, and, a few other things, people are careful, they're watching carefully what could possibly happen with insurance costs or the lack of insurance if it becomes a challenge. So, we talked about the insurances. I think, next in your article, you're talking about anticoagulants and also analgesics. So what's the deal with those two?
Yes. So anticoagulants, or better known as blood thinners. So they are essentially used to prevent blood clots. So your DVTs or your pulmonary embolisms. So they are essentially, or your atrial fibrillations. So they are essentially used to prevent those blood clots. So like I mentioned, you have your Eliquis, you have your Xarelto, you also have your warfarin, Coumadin, Brilinta. So all of those it's important for careful dosing of blood thinners. And it's also important because in the emergency department, we would have older patients, or even sometimes like middle-aged patients, they would come in from a fall. So if you come in from a fall on a blood thinner, it's a level 3 trauma because because you're on a blood thinner, so you can bleed more easily. So you can have those infarcts within your brain. It's just very important. So they get sent straight to the CT scan if you're on a blood thinner and you fall. So careful dosing is definitely essential when it comes to anticoagulants. And then the analgesics, the pain medications, they work towards pain signals within the brain. So you have your NSAIDs, such as ibuprofen, that treats like headaches. You have your opioids, which is I'll touch on that after because that's also important for careful diagnosing. You have your topical agents such as like lidocaine, and then you also have Tylenol, which treats medications like back pain. But back to opiates, it's super important to know, and your doctor, it's super important for your doctor to know what type of opiates to treat, because the opiate crisis is still kind of going on with substance abuse, whether it's hydrocodone or oxycodone. Yeah. Anything like that. So it's super important for careful diagnosing because, pain is excruciating. I've never experienced back pain, but patients that came into the ED came in with back pain, or they came in with different variants of pain, and it has to be treated. So they're prescribed with a Lorcet, or which is hydrocodone, or they're prescribed with a Dilaudid or something like that that treats that pain. But it's very, very important to know the dosing on the oxycodone and not to take too much per day. So those opioids are definitely pretty tricky as well to diagnose and treat.
There was some information out about the use of ibuprofen versus acetaminophen. Which is harder on your body? Do you know?
I would say that Tylenol is definitely treats pain more effectively, I believe, than Motrin. Because Motrin, I believe, is kind of like for your lower acuity, like your headaches. But your Tylenol, like they wouldn't really prescribe ibuprofen really in the ED, but they would prescribe Tylenol or acetaminophen in the ED, whether it was like 600 milligrams, just to kind of lower down some pain. Like if a patient's presenting with back pain or abdominal pain, they would prescribe them maybe with some acetaminophen and another medication to combat that pain. So Tylenol, I believe, is definitely more effective than ibuprofen or Motrin.
Okay, all right. And then, of course, there are cautions against long-term use.
Yes.
So let's talk about that a little bit when it comes down to both of these drugs, the ibuprofen and the acetaminophen.
Yeah, so long-time use is definitely very pertinent to know, and that's where consulting your doctor, and that's why you need a primary care doctor that can manage your medications when it comes to those lines. It's super important to know. Like I said, you need to know, and I even have a vitamin. So I have like a vitamin Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, just to know what type of medications I'm taking daily, because you don't want to overtake them and you don't want to not take your medications if you're prescribed them. But long-term dosing can certainly, because it can have its benefits and it can also have its consequences. So it's very important to consult your doctor when it comes to taking these certain medications.
Mm-hmm.
So,
go ahead.
Well, that's why you can't wait until you finish medical school. Let the people know how important it is for a primary get to your primary physician.
Very important.
Yeah.
Mm-hmm.
Wow.
So the final thing that you mentioned in your article are antibiotics. Let's talk about antibiotics for a minute.
Yes, so antibiotics, very important. So I actually just presented about antibiotics in my master's program. So we had to pick a topic, and I picked pneumonia. So I talked about various antibiotics, and I talked about three main ones. I talked about amoxicillin, I talked about azithromycin, and then I talked about doxycycline. And then there's different types of antibiotics that treat. So you have your UTIs, which has your cephalexin, and then you can also have Bactrim as well that treats your skin infections. So each of those antibiotics, normally you take antibiotics for 7 to 10 days normally. But it's important to take those antibiotics because bacteria can certainly enter the blood and can cause infection and eventually can even cause sepsis. So it's important to take those antibiotics for those periods of time. And if you don't see any improvement, then you definitely need to consult your doctor for immediate intervention as well.
Mm-hmm. And I know that most of the time when you are prescribed an antibiotic, you are encouraged, or actually the emphasis is placed on taking the complete prescription.
Yes.
Don't stop when you start feeling better, right?
No. Yes,
right.
That's certainly important. Take the whole period. So if it's prescribed for 7 days normally or 10 days, take the whole period of your antibiotics because it's treating that. Definitely recommend that. Take that whole period for sure.
Mm-hmm.
Yeah, I always question that for some reason. And I'm not a doctor physician. When I was given antibiotics a long time ago, said don't stop taking them.
No.
For that particular time, after that period of time, or before.
Yes.
But when it says to take them for 8 days or 9 days, carry it through. Take them all.
Take them all.
Yeah. So Christian, tonight we're exploring two things. One, the question, why take medicine? So if you had to sum up everything that you just shared with us tonight, why is it necessary to take medicine? Or on the flip side of that, should people explore other options aside from medicine? So I think that would lean into the future of pharmacology. So let's answer the first part. Why should people take medicine?
Yeah. So number one, just preventing disease progression. I think that's important, as well as controlling symptoms. So if you experience chest pain, if you experience shortness of breath, it's important for immediate intervention. So I believe that effective treatment, preventing disease progression, as well as controlling those symptoms is truly important, as well as reducing risk of hospitalization. No one wants to be admitted to a hospital. And also lowering the risk of just serious events, I think is also very important. So just making sure you take it on time, making sure that you take your doses. I believe taking those medications are very important. And when it comes to other variants, to answer your second question, I believe instead of taking medications, like I mentioned in the first broadcast, lifestyle medicine. It's important to practice lifestyle medicine, no smoking, try to limit alcohol, have a healthy diet. All of those different types of variants, like I said, will help us live to 96. And it depends genetically. Life is so unpredictable. So it just depends. You can have a rare cancer. So it just depends. But preventative medicine and taking medications on a daily basis will prolong life expectancy. That's why life expectancy has increased over the years, because we've been taking medications, because we have a future of pharmacology, because there's been more precise diagnoses, because there's been more precise dosing and labs and techniques. That's why we take medication. But taking that medication will certainly increase your life expectancy. I know some people may be kind of, should I take this medication? Should I not take this medication? I think the biggest point to come out of this is to consult your physician and to consult other physicians as well, because you can get someone's point of view and you can also get someone else's point of view. So it's very important to consult your physician so that you can become more educated, as well as doing your own education as well. I feel is also very important when it comes to medication. So yes, so please take your medications for increased life expectancy.
Mm-hmm. And a part of your article mentions advancements in technology, and we certainly can't dismiss the fact that AI is everywhere, right? And so, I'm sure that pharmacological research it might be impacted by artificial intelligence. Lab work could be impacted by artificial intelligence. Where do you see medicine going in terms of the research and, some of the discoveries, and also, I guess, kind of that profile of pharmacology and how the drugs interact? Do you think that the advancements in technology will help us to better understand? Do you think it might become, like a little bit too much? And, I'd love, lean into that a little bit.
I think it can go both ways.
Okay.
Obviously, AI can be a tool, but it can also cause a lot of stress because, like myself, I'm going to research if I have a little bit of chest pain, what's going on with me. And obviously the first thing that pops up is, oh, you're having a heart attack, so it kind of just, it has its pros and cons. But I think on the good side, I feel like it'll definitely accelerate the discovery of new potential drugs that can help treat patients. I think it can also help patients personalize their own treatment plans, and it can help out with administrative processes. But on the other side, like I was saying, it can definitely cause more stress because AI will break down everything. It will break down your symptoms. It will break down your treatments. It will break down everything. So if you're a worrier like myself, then that is going to be detrimental. So I tend to stay away from AI when it comes to healthcare diagnoses and stuff like that. So as a physician, I probably won't be using AI to diagnose any of my patients. I'll rely on my medical education for sure.
You're right, because you can have a hangnail and Google it to death, WebMD it to death, and think you're going to be dying like in the next 5 minutes over a hangnail. So you really have to kind of balance that consumption of that information. And also, if people are going to use AI as a tool to even just kind of remotely figure out what could be going on with them, knowing what is appropriate to input into artificial intelligence in order to get the right answer. So, if you're not savvy with that, stay away from it because it will cause you to lose sleep at night. For the most part, as we said before, it sounds like noting your symptoms, having those discussions with your physician. If you are prescribed medication, making sure that you are paying attention to how you feel, the side effects, talking about those things with your physician, and then let the experts do the work, and then, of course, on the flip side of that, making adjustments that will hopefully help you to get off of some of these medications at some point. I think that's a goal for everybody. I certainly look at my pill bottles and I'm like, man, this is getting a little crazy. But we were talking about leaning into, diet, eating healthier, more fresh fruits and vegetables, things of that nature. Just, kind of, I guess, finding that balance to make sure that it all works, because even those things are not going to work immediately. It will take time when you're doing something holistically, and medication might be needed, I can imagine, to at least get the things under control, that are harming you or whatever. So I guess what word of advice is kind of a ending to this discussion would you have for anyone who just has questions about how they should, embrace their prescriptions or their health and what they should do?
Yeah, so I think the biggest. Oh, did you have something, cousin?
Well, when you finish, I was going to revert to the AI discussion, just a tiny tap, because I know what AI is, but I think we have some people out there who probably want to ask a question to go in depth into what AI is, and if you're able to elaborate just shortly, because I know we don't have too much more time.
Yeah.
What it is and how it pertains to medicine, what role that AI plays in medicine, because we talked about it as if everybody knows, what it is. Okay, so could you just elaborate just a little bit?
Yeah. So AI is
April, you asked him to elaborate on something. I didn't.
I totally forgot. You totally took the thought away. So we're going to go into artificial intelligence now. Go ahead, Christian. I totally forgot what I asked. So when you get to be this big age. Go ahead.
So AI is definitely transforming medicine when it comes to. So it's definitely, I feel like it's improving healthcare outcomes, because just think about it when you think about radiology. And just reading those CT scans and reading those X-rays and reading those MRIs that radiologists can't really, so radiologists are really good, but AI can see things that we can't see within our eyes. So when it comes to diagnostics and imaging, and when it comes to patient charting, one of the physicians I was working with, so patient charting, so essentially patient charting is like history of present illness and review of systems and getting the patient's exam. As the medical decision making. AI is writing patient charts for the physicians, some of the physicians. So it's crazy how AI is kind of transforming. And also when it comes to the administrative side, such as like scheduling and billing and medical record management, it's just crazy how AI is just filling in so many roles that we saw humans doing, but AI is filling in those roles now. So it's definitely helping out with information and support. But it's also, I feel like, taking some jobs away from healthcare professionals, from not even just healthcare professionals. AI is taking jobs away from a lot of different people as well. So artificial intelligence is transforming medicine as well. It's going to keep on transforming medication because there's medicine because AI is just continually to grow. There's new different types of codes and different things like that. So it's growing for sure.
Yeah. Okay. Sorry, April. You can go back.
That's all right. But Christian, it sounds like we have another topic that you can write about, which is the future of AI in medicine.
Right. That's right.
I have that one listed as one of my next topics.
Absolutely.
Mental health, and then AI was my next one. So
here in Winston-Salem, we have the WFIRM, which is basically the Wake Forest Institute for Regenerative Medicine.
Yeah.
And I'm sure that AI plays a really big part in that particular work, because it is all about cutting edge discoveries, developments in medicine, everything from actually creating ears and hearts and things in the lab, which I'm sure, AI probably has some role in that, and that's fascinating. It's straight out of sci-fi. It's really something just intriguing to see, and to even, to try to comprehend that it actually exists, right? And so, I think, though, that people don't need to be afraid of it. But again, going back to just making sure that there is a skillful and informative use of AI if you want to do your own research, making sure that your sources are legit, because there's just so many different things out here that are, pumping out information. Most of the AI generators are actually kind of aggregating all this information together to give you what you're asking for, but then you still need to ask the questions. You still need to be an advocate for yourself. Ask if the information is accurate, when you're talking to your physician. And, but I think that, as far as what you discussed with us tonight and, pretty much the impact of pharmacology as it was and as it will be in the future, it just sounds like there are some new things on the horizon. There's still some old tried and true medications that are out there that haven't gone anywhere. And, probably 5 or 10 years from now, who knows if we'll even know or have those medications. But for now, they're still a part of daily living when you are under medical prescriptions. And so this has been very informative. And thank you so much, Christian, for joining us tonight. We really appreciate it. There's somebody I think who just dropped in a comment.
Yes, that's my dad.
Who is this guy?
Yeah, exactly. Absolutely. So doing a great job. This was a great conversation. Really appreciate it. Yes, and so, Brother Edward, again, this is coming out in the July edition. When is the July edition going to drop?
Hopefully by Monday. The printed copy by Monday coming.
Awesome. Yeah. So you'll be able to read Christian's full article when the July issue of World Community Magazine hits the streets. If you have your subscription, Brother Edward, of course, will send all of that out to you. If you need one, get in touch with Brother Edward and he can get you set up. But Christian, thank you so much for joining us tonight. We really appreciate all the great information and keep up the good work.
Yes, ma'am.
Well, look, April, I think Christian is going to come on, more frequently, I guess, to give us a preview of his articles that is coming in the magazine, like he's doing tonight.
Yes.
And we can welcome all of that.
Yes. Yeah, absolutely.
Okay. Yeah, we'll welcome all of that.
Yes, absolutely. So, Christian, before you go, and Brother Edward, before we close the show, I do want to let everyone know that we have wrapped up the 4th week of the World Community Magazine Summer Jobs Program. We had our 4th session today, and now the participants are getting ready for their career exploration experiences out in the community. They'll be doing that over the next 2 weeks, and I just have a photo that I want to show everyone. This was the crew today, Brother Edward.
Well, I saw that. Yeah.
Yes, all the smiling faces.
Oh.
We had a really good time today. Just kind of talking about career exploration, and we used an interest profiler to make sure that what their interests are in terms of doing things and being involved in certain areas. That all comes together to actually create a profile of the type of careers that you would be successful in. And they all took the profiler, and we talked about their results. So we're getting ready for some wonderful things in the community, and this group represents students who are interested in medical, engineering, IT, culinary, business entrepreneurship, early childhood education. I don't think I'm leaving anything out. Law. And then, there's a couple that are like, I like a little bit of everything. So the career exploration experiences will give them an opportunity to see those things and to feel those things, to be in those environments so they can make an informed decision about their major whenever they go to college, or if they're going to enter the workforce immediately after high school, they have a better idea of the type of work that's out there. So, Christian, with you being pretty much, newly grad, going into med school and all of that, I'm sure you can relate to what these young people are, trying to do as far as deciding on a career path. What advice would you give them if you were talking to them about choosing a career path, but also following their passion?
Yes. So like you said, chase your dreams. I think it's definitely important. I think I talked about this in the first broadcast, is where when I was younger, I was like, I can't do this. I can't do that. But I've had mentors such as Dr. McIver, such as my dad, that have helped me tremendously. So chase your dreams and believe in yourself. I think it's very important, and it's really cool because it kind of comes full circle because I worked in admissions at Furman, and we just talked about what would you do if I was in their shoes. And every single time my advice would be is to chase your dreams and to believe in yourself, because if you put yourself to it, you can do it. So I feel like that's definitely one of the biggest, and have faith. I think that's the biggest thing.
Yeah, absolutely.
Yeah, man. I'll tell you.
Well, Brother Edward, it's been a great show tonight. Thank you.
It's always great, April, when we have Christian.
Thank you, guys.
Oh, really? Oh, it's always great when he's on the show. I can wait in the background for something of confidence that I can gain confidence in his message, whatever his message is, and his explanation of what's going to be talking about or writing about. I think that's very important, just to people who you really, who's at the threshold of that kind of knowledge. I know they're asking questions about is he a doctor? We gotta let these people know. Maybe we should say that as in the beginning. April, a couple of people had birthdays over the weekend. Very important people. Very, very important people. Miss Priscilla Fuller, she had a birthday. She must have been having a good time, but you couldn't talk with her on the phone and all that good stuff. And guess who else? And she's in town too. Sherilyn Johnson.
Sherilyn DeWitt. Yes.
Sherilyn DeWitt.
Yes.
So happy birthday, Sherilyn, and happy birthday, Priscilla.
Absolutely.
We're not gonna mention age, okay? I'll relieve them of that. I know they're probably on edge right now, thinking that I'm going to call their age. I don't know their age. But anyway, we're thankful to our audience, and thank everybody for tuning in this evening. And you can expect more information from our guest tonight, Christian Newman, in the coming months, and on a regular basis. And we're thankful for him and thankful for his knowledge. If there's April, you have anything you want to say? Today. Well, yesterday, day before yesterday, Judge Butler retired. Judge Aaron C. Butler, he was as of up to date at 12 o'clock noon. He was the Horry County Magistrate Judge, and he's been that way. I think since 2000, I believe 2003, something like that. And he served us well. We're going to have a good write-up about him in a few days, coming in this next issue of a magazine. And today, that transition had taken place at the J. Reuben Long Center, where the young lady took his place was Miss Angela Brown. And we're going to let the people know what to expect based on what the information that we had gotten anyway. And we're going to respect what we had in the past. We had a gem of a person, a diamond of a person, Judge Aaron Butler. And we're blessed to have him still with us. Okay. And we had him for a long time. And thanks. So without any further ado, I'm going to say good night to everyone. And thank you, Christian and April.
Yes, and if you're doing any celebrations for your day off on Friday, just be safe and enjoy yourselves. But other than that, we will see you next Tuesday night at 7 p.m. So everyone have a good night. And thank you again, Christian. We appreciate it.
Thanks, man. We'll be talking.
All right.
Yes, sir.
Yes. All right.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook.